Acanthocheilonemiasis. Acanthocheilonemiasis is a rare tropical infectious disease caused by a parasite known as Acanthocheilonemiasis. It can cause skin rashes, abdominal and chest pains, muscle and joint pains, neurological disorders and skin lumps. It is mainly found in Africa. The parasite is transmitted through the bite of small flies. Studies show that there are elevated levels of white blood cells. Acanthocheilonemiasis belongs to a group of parasitic diseases known as filarial disease, all of which are classified as neglected tropical diseases. Filarial disease results when microfilariae, which are nematode larvae, reach the lymphatic system. Microfilariae reside in the serous cavities of humans. They have a 5-stage life cycle that includes birth to thousands of live microfilariae within the host, and then translocation via blood meal to the dermis layer of the skin. It is here that microfilariae cause major symptoms, which are edema and thickening of the skin and underlying connective tissues. It can also cause skin rashes, abdominal and chest pains, muscle and joint pains, neurological disorders and skin lumps. In addition, it causes spleen and liver enlargement, which is called hepatosplenomegaly. Studies show elevated levels of leukocytes, or white blood cells, which is referred to as eosinophilia. It is mainly found in Africa. The parasite is transmitted through the bite of small flies. The clinical manifestations of A. persistens were first discovered in London in the blood of a patient from West Africa in 1890. The parasite was originally called Filaria sanguinis hominis minor because it was similar to another microfilariae, except smaller. Microfilariae are small larvae that have the ability to enter the body's circulation. Filaria sanguinis hominis minor is now called Filaria persistens, which was established by the International Commission on Zoological Nomenclature. Since its discovery, Acanthocheilonemiasis has had several other names. It was first known as Mansonoiasis, which referred to an infectious disease of any of 3 parasite species, including Ozarti, persistens, and Streptocerca that share similar life cycle characteristics. However, it is now widely accepted as M. persistens. Other synonyms for Acanthocheilonemiasis include Diptylonemyasis, Diptylonemia persistens, Mansonoia persistens, and Acanthocheilonemiasis persistens. Acanthocheilonemiasis is caused by the parasite, Mansonoia persistens. M. persistens is primarily found in Central Africa and in some areas of South America, therefore the most affected populations are located in these areas. Acanthocheilonemiasis affects humans in these areas in equal numbers. The prevalence of this condition does significantly increase with age. Furthermore, the parasite is most commonly found in areas of tropical forests with alternating swamps and open ground. Approximately 114 million people in Africa are infected with M. persistens, including 33 sub-Saharan African countries. Recent studies focused on Gabon specifically, where febrile and tropical diseases are common. Contrary to popular recent suggestions, M. persistens does not influence the emergence of febrile diseases, including HIV, tuberculosis, bacteremia, and malaria. In general, hemoglobin levels in individuals with malaria are severely reduced from that of a healthy individual. Reduced levels occur because the malaria parasite, Plasmodium falciparum, utilizes human hemoglobin as its major energy source. Filariasis, in combination with severe malaria, actually shows higher hemoglobin levels than in severe malaria alone. In addition, M. persistens did not have adverse effects on those with HIV, as there were actually higher levels of CD4 in HIV patients CO. infected with M. persistens. Further research in this area may allude to clinical manifestations of this infectious disease, as there could be possible benefits by contracting M. persistens. Tropical and sub Tropical regions are the main areas affected by nematodes and parasitic worms, which often causes filariasis. Around 20% of immigrants to Spain are children from these regions. There are concerns about absolute eosinophilia in immigrants that is correlated with parasitic diseases that may go undiagnosed. Absolute eosinophilia is clinically diagnosed as greater than 0.45 times 109 eosinophilic leukocyte cell of peripheral blood. Recent studies suggest that around 60% of children with relative eosinophilia contracted this via parasitic infections. Relative eosinophilia is different from absolute because relative refers to an increase in percentage of white blood cells due to a loss of blood plasma, whereas absolute eosinophilia is purely an increase in white blood cell production. Of those with relative eosinophilia, 40% were undiagnosed until these studies. Therefore, there is a great need for thorough parasitological studies in this area of tropical infectious diseases. Generally speaking, Acanthocheilonemiasis does not show initial symptoms. However, if symptoms do arise, it is typically in individuals who are visiting highly infected areas rather than natives to those areas. A major common laboratory finding is an increase in specialized white blood cells, which is called eosinophilia. Other symptoms include itchy skin, neurological symptoms, abdominal and chest pain, muscle pain, and swelling underneath the skin. If there are abnormally high levels of white blood cells, then a physical examination will most likely find an enlarged spleen or liver. In certain scenarios, nematodes may physically lodge into the chest or abdomen, resulting in an inflammation. Diagnosis of this condition usually occurs via blood smear examination under light microscopy. The standard of care is administration of antifilarial drugs, most commonly ivermectin or diethyl carbamazine. The most efficacious dose in all nematode and parasitic infections is 200 micrograms/kilogram of ivermectin. There has also been other various anthelminthic drugs used, such as mebendazole, levamisole, albendazole and thiabendazole. In worst case scenarios, surgery may be necessary to remove nematodes from the abdomen or chest. However, mild cases usually do not require treatment. Parasitic worms and nematodes regulate many immune pathways of their host in order to increase their chances of survival. For example, molecules secreted by Acanthocheilonemiasis actually limit host effective immune mechanisms. These molecules are called excretory products. An effective excretory secretory product released from Acanthocheilonemiasis is called S62, which can affect multiple immune system cell types. S62 has anti-inflammatory effects when subjected to mice. The anti-inflammatory effect occurs because of a phosphoryl containing moiety and signal transduction. More research needs to be completed, however there is some evidence that Acanthocheilonemiasis may have anti-inflammatory effects, and should be researched further. Infectious diseases. Parasitic disease, helminthiasis. B65 B83. 120-129. Schistosoma mansoni japonicum mekongi hematobium. Schistosomiasis. Trichobilharzirigini. Swimmer's itch. Glenorrhea sinensis. Glenorrheasis. Dicocoelium dendriticum Dicocoelium hosps. Dicocoeliasis. Fasciola hepatica gigantica. Fasciolosis. Opisthorchis vivarini Opisthorchis felinus. Opisthorchiasis. Paragonimus westermani Paragonimus calicati. Paragonimiasis. Fasciolopsis busci. Fasciolopsiasis. Metagonimus yokagawi. Metagonimiasis. Heterophys. Acanthocheilonemiasis, Echinococcus granulosus, Echinococcus multilocularis, Echinococcosis, Neosagenoidea asiatica Neosolium, Neosis cysticercosis, Hymenopus nanohymenopus diminuta, Hymenopiosis, Diphyllobothrium latum, Diphyllobothriasis, Spiromdra rhinoceropai, Sparganosis, Diphyllobothrium mansioides, Sparganosis, Draculus medinensis, Draculisis, Onchocerca volvulus, Onchocerciasis, Lolofilariasis, Mantsnella, Mantsnelliasis, Derphalaria ripens, Derphalaria immitis, Derphilariasis, Wuchereria bancrofti Brugia malayi Brugia temori, Lymphatic filariasis, Nithostoma spinacerum Nithostoma hispidum, Nithostomiasis, Dialaza, Dialaziasis, Gongalenma, hookworm infection, Ancylostoma duodenale Ancylostoma brasiliense, Ancylostomiasis, cutaneous larva migrans, Nicator americanus, Nicatoriasis, Angiostrongylus cantonensis, Angiostrongyliosis, Metastrongylus, Metastrongyllosis, Ascaris lumbricoides, Ascariasis, Anisakis, Anisakiasis, Toxica urricanus Toxica urricati, Visceral larva migrans Toxicariasis, Bales ascaris, Diectophyme renal, Diectophymosis, Parascaris quorum, Strongyloides stricrilis, Strongyloidiasis, Trichostrongylus spp, Trichostrongyliosis, Halus philobus gingivalis, Enterobius vermicularis, Enterobiasis, Pinworm, Trichinella spiralis, Trichinosis, Trichuris trichiura, Capillaria philippiensis, Intestinal capillariasis, Capillaria hepatica. Thanks for watching this video. Subscribe to our YouTube channel for more videos.